Hello, today my topic is on hypothermia in the newborn and thermoregulation in newborn. Neonatal hypothermia is a condition in which a newborn's body temperature falls below the normal range. It is a serious condition that can lead to metabolic complications, hypoxia, and the infant's in utero temperature is 0.5 degrees Celsius higher than mother's temperature. There is rapid maximum cooling. Soon after birth, the baby is exposed to the cooled environment, so maximum rapid cooling is occurring during first minute of birth. After birth, skin temperature falls by 0.3 degrees Celsius per minute and core temperature 0.1 degree Celsius per minute. Approximately 15% of the newborn develop hypothermia in developing countries, especially in the cold countries. Now, how does newborn lose body heat? There are four main mechanisms by which baby loses heat. One is conduction, when the baby is coming in contact with the cold surface. Convection, that is baby is losing heat to the cold air. Evaporation, that is the wet parts is getting evaporated and then baby loses heat. Another is radiation. So from the baby, any cold surface, any cold things coming across, the baby will lose heat from the body to that environment. Now we'll see in detail about these mechanisms. So conduction, that is from the heat is being lost from baby to the surface on which the baby is lying. So if this surface is cold, baby will lose heat. Second mechanism was convection, loss of heat from baby skin to the moving air. Number 3, evaporation, that is loss of heat by moisture vaporizing from the skin surface to the air. And radiation, in this mechanism, heat dissipates from baby to colder object in the environment. Examples: walls, windows, if it is kept open, if it is cold. Now just see the examples. Radiation, that is cold room temperature, cold wall. So anything coming cold items on the bed. So if these are there from baby, the heat is getting lost to that part. Conduction, example is cold scale, weighing scale, or the length measuring scale. If it is cold, if the baby is kept in a cold X-ray plates, if the baby is kept in a cold blankets. Convection, the example is bed near the air vent, oxygen left on, and passing traffic. And evaporation, wet diaper is example. Bath, after bath, if the baby is not dried properly, so in those conditions baby will lose heat. Now let's see the response of the baby to cold. So usually if the temperature is going below 25 degrees Celsius, then the baby is showing these responses. There are 3 responses: muscular activity, peripheral vasoconstriction, non-shivering thermogenesis, that is the metabolic process. So out of these 3, number 1 and 2 process is not well developed in case of newborn. So in the muscular activity, which is minimum in case of newborn, postural changes is number 1, but newborns cannot change postures, so it is very difficult for them, and they try to show restless movements, become irritable cries to conserve the heat. Peripheral vasoconstriction is also not well developed in case of newborn, so in this reduces skin blood flow by vasoconstriction and then decreases heat loss from the body that way, and these 2 are not well developed. So in the baby, main mechanism of conserving heat is by non-shivering thermogenesis or the metabolic process. So we'll see in detail what non-shivering thermogenesis is. Non-shivering thermogenesis is the metabolic process where brown fat is metabolized. Brown fat is burned for production of energy. Now you have to know what brown fat is. This is a fat, brown fat, present only in the newborns. So brown fat is an energy source for the newborn, and it is laid down in 3rd trimester of the pregnancy. This brown fat in the newborn is found around the kidneys and adrenals, nape of the neck, mediastinum, interscapular area, in the groins and in the axilla. In the term baby, brown fat is comprising 4 to 10% of the adipose tissue. But in the preterm, it starts laying down or is present after 26 to 30 weeks gestation only. So below that, the preterm is not having brown fat, and it is not as much as term baby. So 26 to 30 weeks they start laying down, but not as much as the term baby. So preterm will have less brown fat. Brown fat is in small amounts. Brown fat cannot be replaced once used. So generally it disappears at 3 to 6 months after birth. But when the baby is exposed to cold stress, then it disappears sooner. So repeated cold stress if the baby has, then the brown fat is utilized more. That means once it is used, it cannot be replaced, so it disappears earlier. Hypoxia causes impairment of the brown fat metabolism. Now let's see the mechanism of heat production, that is by non-shivering thermogenesis. First, baby is exposed to the cold. So when the baby is exposed to the cold, the thermoreceptors in the skin is stimulated, and from this it sends afferent fibers. Through the afferent fibers, the signal goes to the anterior hypothalamus, where sympathetic nervous system is stimulated, and from there efferent fibers come to the brown fat tissue, where it triggers release of noradrenaline, and this noradrenaline oxidizes triglyceride to fatty acid and glycerol, leading to number 1, heat production in 30%, 60% re-esterification, and 10% release into the blood. So the heat produced is dissipated by blood vessels to various parts of the body. The baby needs, during this process, baby needs extra oxygen and glucose. So there is high risk chance of baby having hypoxia and hypoglycemia. Growth is also affected because the calorie is being used to stay warm rather than for growing. An effective thermogenesis requires intact CNS pathway, that is the intact hypothalamus, adequate brown fat, glucose and oxygen. So these 4 points are important, essential for this thermogenesis. So this is in the diagrammatic form. From the skin, when the baby is exposed to the cold, the thermoreceptors are stimulated, and then from here signal go to the brain. From the brain, the efferent fibers are coming from the brain in the hypothalamus. From anterior to posterior thalamus, efferent fibers come, and then it shows the effect. Actually it shows 4 effects: vasomotor response, vasoconstriction, metabolism, sweating, and then shivering. But in case of newborn, only metabolism, number 2 process, that is metabolism, is functioning. Otherwise other 3 mechanism is not yet properly developed, so they cannot respond well with other 3 mechanisms. Now prematures are more susceptible to heat loss. So why the premature are susceptible to heat loss? The reasons are: number 1, high surface area relative to body weight. Premature babies have thin non-keratinized skin. Prematures lack insulating subcutaneous fat. They lack thermogenic brown fat, and they have underdeveloped shivering sweating mechanisms. Poor vasomotor response is there, and the limited calorie intake to provide nutrients for thermogenesis, and they are unable to maintain flex posture. Unlike the term babies, they have a flex posture, but preterm babies, they have extended posture. They cannot flex because of the hypotonia, because they have less tone than the term babies. So unable to maintain the flex posture to reduce effective surface area and preserve heat. So because of these reasons, prematures are more susceptible to heat loss. Let's see what is thermoneutral environment is. This is actually a narrow range of temperature. So that temperature is 36.5 to 37.5 degrees Celsius. And this is also known as zone of thermal comfort. So thermoneutral environment is defined as narrow range of body temperature at which baby can maintain normal body temperature with minimal oxygen and energy expenditure. So this time baby has minimal metabolic rate. Okay, now come to hypothermia. The definition of hypothermia. It is defined as the core body temperature. Core body temperature is rectal temperature. So that is less than 36 degrees Celsius or skin temperature less than 35.5 degrees Celsius in a newborn. The temperature can be recorded in the newborn in the through rectal, axilla or skin, and skin and rectal temperature is more used than axilla. Now come to etiology of hypothermia. So one, due to excess heat loss by those 4 mechanisms. Another is inability to conserve heat, and another is if there is poor metabolic heat production, then there is high chance of hypothermia. Now severity of hypothermia or the classification of hypothermia based on core temperature, and that is defined by WHO. So 36.5 to 37.3 degrees Celsius is considered normal in case of newborn. Cold stress is 36 to 36.4 degrees Celsius. Moderate hypothermia is 32 to 35.9 degrees Celsius. Severe hypothermia is below 32 degrees Celsius or 89.6 degree Fahrenheit is severe hypothermia. Now risk factors for hypothermia. All the newborns, they are at risk at first 8 to 12 hours of life. If the baby is premature, they are at higher risk. Small for gestation age babies. If there is CNS problems, mainly the hypothalamus problem, prolonged resuscitation effort where the baby is exposed to the cold surface or the cold air for a longer time. Sepsis is another risk factor. Hypoxia and hypoglycemia are the risk factors for hypothermia. Now come to clinical features of hypothermia. Depending upon the severity, they will get minimum finding to the maximum. So baby will be cold to touch. There will be, if the baby is having cold stress, then periphery are cold but the abdomen will be warm. If both abdomen and the abdomen skin and the peripheral parts are cold, then that means the baby is having hypothermia. Mottling or pallor with acrocyanosis can be seen. Feeding is, baby is reluctant to feed. There is increased gastric residuals and abdominal distension can be seen. Baby is hypotonic, sluggish and lethargic. There might be hypoglycemia. Baby feels uncomfortable, so shows restlessness, cries to generate heat. There is bradycardia, tachypnea. Shallow irregular respirations can be seen. Even apnea is present. And low blood pressure, baby is hypotensive. And then poor weight gain, brain growth may also be affected. They have low immunity, so high chance of sepsis is there. So whenever there is hypothermia, it's always better to treat sepsis along with that. The adverse consequences shown by hypothermia. So high oxygen consumption is there, so clinically they present with hypoxia or bradycardia. High glucose utilization is there, so hypoglycemia is present. High energy expenditure is there, so reduced growth rate, lethargy, hypotonia and poor suck and cry can be seen. Low surfactant production, so respiratory distress syndrome can occur. Vasoconstriction leads to poor perfusion, so hence metabolic acidosis. There might be thermal shock, DIC and even death. And severe hypothermia, there can be internal bleedings, GI bleedings. Now, how can we prevent heat loss? So for this, various mechanisms can be used. One is KMC, kangaroo mother care. You can use open care system with the radiant warmer and then incubator which acts like a uterus to keep the baby warm. So these devices can be used to prevent heat loss. Strategies to prevent heat loss by convection. So for this, you can place the infant less than 1500 gram in incubators. Warm all the inspired oxygen. Open warmers, if in the open warmers, keep the sides up and then try to cover the infants. Strategies to prevent heat loss by radiation. For this, avoid placing incubators, warming tables near cold windows, walls or air conditioners. Place a knit cap on the infant's head. Wrap tiny babies in plastic sheets, and like you see in the diagram, and increase environmental temperature. Strategies to prevent heat loss by conduction. So try to prevent the cold surfaces. So don't put the baby on the cold surfaces. So for this, place warm diaper blanket between neonate and cold surface. Place infant on pre-warmed table at time of delivery. Warm all objects that come in contact with the newborn, and then skin to skin contact, that is the kangaroo mother care. Strategies to prevent heat by evaporation. So you should be trying to keep the place dry and baby dry. So dry environment, dry baby immediately after delivery, immediately after bath. Place preterm or small gestation infant in wrap bag at delivery, and delay bath until temperature is stable. Okay, now rewarming hypothermic infant. How you should rewarm the hypothermic infant. Rewarming should be done very slowly. Just 0.5 degrees Celsius per hour should be the rate. And then during this, monitor very closely the vital signs. Every 15 to 30 minutes you should monitor the core temperature, blood pressure, because rewarming may lead to vasodilatation and hypotension. So you have to monitor this. Heart rate and rhythm. Bradycardia arrhythmias are commonly seen. So you should be checking all these vital parameters so that you can see whether you are in the correct way rewarming the baby. Guidelines for rewarming, especially in the radiant warmer and then incubator. So incubator is always better control than warmer, and so in both you have to set temperature 1 to 1.5 degrees Celsius above the core temperature. So set temperature of incubator or warmer should be 1 to 1.5 degrees Celsius higher than the baby core temperature. Then assess infant core temperature every 15 to 30 minutes. Then when core temperature reaches set temperature and infant is not showing any sign of deterioration, then increase the set temperature again by 1 to 1.5 centigrade higher than the infant core temperature. Then continue this way until a normal range of temperature is maintained or achieved. Now signs of deterioration during rewarming. So during the rewarming, if the baby has tachycardia, that will occur due to decreased cardiac output. If there is cardiac arrhythmias, hypotension, hypoxia, desaturations, worsening of respiratory distress, worsening of acidosis, then you have to check the technique or method. So you might be wrong. So these are the deteriorating signs at which you should be aware. And management of hypothermia, give IV dextrose to meet increased demand of glucose and to treat hypoglycemia. You have to give oxygen inhalation because there is high chances of hypoxia. Give antibiotic because they are susceptible to sepsis. Vitamin K 0.5 to 1 milligram IV or IM, especially if there is a hemorrhagic manifestation which occurs in severe hypothermia, where there might be internal GI bleeds also. Then exchange blood transfusion if DIC develops. DIC is disseminated intravascular coagulation. Lastly, try to maintain warm chain to prevent hypothermia. This has a 10 steps. Number 1, warm delivery room. Number 2, immediate drying after delivery. Skin to skin contact, that is a kangaroo mother care. Initiate breastfeeding as early as possible. Bathing and weighing should be postponed. 6, appropriate clothing and bedding should be arranged. 7, rooming in, that is keeping the baby and mother together in the same room 24 hours. 8 is warm transportation. And 9, training and awareness, that is educating the mother, caretaker or the health workers, and monitoring the temperature. Detail about all these steps I have discussed in my another lecture, so you can watch that lecture for details regarding these 10 steps in maintaining the warm chain. Thank you. I will come up again in the next class with another newborn topic.